Ever wonder why your hip still hurts, even after you might stretch it every day and you start walking like this? You've tried everything. You stretch it, you've been to the physical therapist, the chiropractor, massage, acupuncture, and it still comes back. So let's take a look at what that might be, why it's happening, a few things that you could do about it, and then let's also look at why it might not even be your hip. When your hip is painful, your brain starts to blur its map of that joint. Ever notice how you start to move differently when your hip aches? That's your brain protecting you, and you might not even realize you're avoiding putting weight on that side. So then what happens? Well, you shift your weight, your system then adapts to that new shift, and then suddenly your posture changes. So that small shift in your hips can actually ripple all the way up to your neck and again affect your posture. This is why we don't just stretch the hip. We train the muscles and connective tissue in conjunction with your eyes, your vestibular system, so that your brain can then reconnect the dots and move with less tension and less pain. So let's now take a look at a few quick drills to help reconnect all three systems, because it's not about doing more, it's about doing smarter. So before we start our drills, we want to set a baseline. I'm going to use a range of motion baseline, and it's a full body one. So I'll put my palms together, okay, keep my feet on the ground, and I'm simply going to rotate, mark where I'm at, and then go in the opposite direction and mark where I'm currently at, because we want to see if each of these drills actually help increase my range of motion. So the very first thing I'm going to do is sensory. I'm going to use my knuckles for this one. And I'm going to do this all around my hip joint here just for about 10 seconds. We always want to do sensory before movement, because if we can't feel our joint and we don't know where it is, you can't move it with quality. So I'm going to do this just for a few more seconds, get all around the joint, and this alone could give some relief. So you always want to do this before movement. So just the sensory alone, I'm going to reassess and see what that did, and it did increase my range of motion by a few inches in both directions, actually. So I highly recommend always sensory before movement. The next thing we're going to do, and notice I have a T on the ground here. This is to mark so that I'm always in the same spot every time I reassess, so I can fully reassess. Next thing we're going to do is something called gaze stabilization, and I'm going to use this pen. And the reason I like using a pen is because I could use the tip, and I have a very small point that I could focus on. And all we're going to do for this particular drill is put it right in front of me, right at eye level, and I'm going to look at it, and I'm just going to stare at it, literally stabilize my eyes on it for 10 seconds. What this is doing is working all 6 on each side of my ocular muscles. They're all engaged. So it's like an isometric exercise, as if you're doing a bicep curl and keeping your arm loaded with that weight. So 3, 2, 1. Okay. Let's see how that did. So, and now my range of motion is actually a lot further. So just waking up the eyes there and engaging all of the muscles really helped. The last thing we're going to do, I'm also going to use this pen here. This is called a VOR, and it's working our vestibular system, which is a part of what helps with our balance and keeping us upright. I'm going to put this pen at the same distance. It's about arm's length. I'm going to keep my eyes on this pen point and move my head. So there's a natural reflex happening within my eyes as my head moves back and forth, and we're working those little tiny canals that are inside our ears. So I'm going to do 3, 2, 1, and that's it. Now let's see what that did. Last one, and I'm actually now even further. Okay, about the same there, but I went even further on my right side. So those are 3 drills that we could do, and this is a part of how we look at everything holistically. We find things that work for the nervous system that can indirectly and directly help the problem joint, in this case, our hip. So give those a try. Let me know how you did. Let me know what questions you have, and I look forward to hearing from you.